Welcome Dr. Sachin Shah. First
Thank
of
you so
all,
much.
Team Illusion and ChairSide is so happy we could host you right now. If you could just start with a short intro of yourself.
Sure. So, my name is Dr. Sachin and I've been practicing since last 22 years. And the journey so far has been really exciting. Right after I graduated from college, I just started every other dentist who started with a dental setup, which was a small dental clinic with single chair. But always the core was education, upgradation and the technology. This always inspired me going ahead, learning more. There are a lot of opportunities. I have visited a lot of countries abroad for continuing education, and this all always give me that why we cannot have some similar international standard of dentistry here, which led to making of Oracare Prime, and now our setup is like a 5-chair dental clinic with state-of-the-art equipments.
Wonderful. So Dr. Sachin, what was that thing that was lacking in your practice that made you buy the 3-shape trio scanner?
See, Siddhi, in patient journey, one of the most important factor is the patient experience. With conventional impressions, it was a very messy experience with the patient, cumbersome, gag reflex, a bad taste, as well as it was technique sensitive for the dentist and the entire dental team. So we were always thinking that what could be the next thing, how we can make this experience better, and then came into the dental scanners, and obviously 3-shape dental scanner is amazingly fast, accurate, superior, giving a wonderful patient experience.
So how have the scanners helped you in your workflows and your feasibility?
I'm using scanners like intraoral scanners since last 4 years, and it's a wonderful experience. The very initially it was so exciting and awesome for the patients when they saw their teeth in front of a screen, 3D movement. It was really amazing. Patients were taken away with this, believe me. And plus, they were more interested now to know more about their teeth. That was the co-diagnosis. They were interested in asking me, what is this? Is this a cavity? What is this black spot? Why the gums are showing red? And which helped me to convert my patients from a smaller treatment to a bigger treatment. The turnaround time has been amazingly fast. We're able to see more patients day in and out because it takes very few appointments compared to the conventional dentistry. One incident I will tell you, in my very beginning, first year when I started using the scanner, we had one patient. She was an old lady, asthmatic. She used to be always on oxygen on a dental chair, and we took her implant scans. Normally would have taken 4-5 appointments with a lot of choking and gag reflexes. We finished this case in just straight 3 appointments.
Wow.
Absolutely amazed, and that was a wonderful investment. I thought this is the way it should go, and then from there was no looking back. We used the scanner for multiple cases, right from single crowns, full arch implant scans, and this has helped us to take our practice to a new level. Plus, patients' comfort is at the core. We are so happy.
So Dr. Sachin, I have seen that most dentists they are considering buying the first scanner, but they're not convinced. And here you are with your second scanner. So what message do you have for our fellow dentists?
So Siddhi, as I was telling that we are using scanners since last 4 years. So there is no doubt that a scanner is a must in a dental practice. Every dental practice should have one scanner at least. Now, after using for 4 years, we have been so used to the scanner that every other patient were using the scanner for multiple purposes, right? From diagnosis, treatment planning, impressions, scans for aligners, splints, smile design. So each and every patient, when we're doing this, there is a tremendous demand within us. Like all the doctors are finding that we want the scanner, we want the scanner. So I just thought, why not to have a second scanner? Because sometimes I thought we were missing on the opportunity to convince a patient if you're not taking a scan for any higher treatments or full mouth cases. So the thought came, let's put it, let's have a second scanner and probably to change or give us more faster rate to see the patients and get them convinced. And since a couple of months when I'm using the scanner, it has proved it. We are really able to get the rate at which we are seeing the patients faster, and believe me, it's worth.
So it helps with the whole patient conversion.
Absolutely.
And convincing them as to why the treatment is important.
Like when the single scanner we were using, there was a pause moment when one patient is getting scanned, the other patient is waiting. So I said again, this is not the patient experience, right? At the same time, a patient walks in, a scan should be there, and they should be able to see their teeth, visualize. At the same time, I also wanted, we need to sometimes do a treatment planning. So every workstation, as of now, we have got a client server setup where the whole database of the scans is on the server, and every desktop in the clinic, we can visualize the patient scans, we can edit, we can work on it. So it's just on and on. Our workflow is continuous.
So Dr. Sachin, since the time I have entered your clinic, I realized that you are very tech savvy. Everything around me is absolutely digitized, from the LED screen to the scanners, all of it. So what do your patients have to say? Like, how do they react when you're coming in with a scanner and showing them their entire, oral view?
They are just amazed. It's like a wow, and which I wanted. The core of it is a patient experience, because I do break that myth. Patients saying I hate the dentist, I hate the dental clinic. I wanted them to come to the clinic with a wow factor, give a pleasant experience. And technology has always been core. I've always been amazed by technology, so I tried utilizing the technology as far as possible, and utilize in the betterment of the patient treatment.
So what is your message to our fellow dentists who are perplexed about going digital?
I would say, digital is the present. It's not the future, it is the present. So somehow the whole world has got digitized, and COVID has proven it. Digital is way we have to move ahead, right from the way we communicate, the banking institutions, social media, everything is digital. So why dentistry should be far away? Dentistry in fact is actually into digital, and it has helped tremendously to me. From a 2-chair dental practice, what was I was having 3-4 years back, now today we are into a 5-chair dental practice.
Wow, that's amazing.
With state-of-art equipments, and in fact this has boosted our practice. Our practice has grown multiple times, which is an indicator that our patients like it. Our patients are looking that dentistry is different, they're liking it, they're referring us more patients, which is taking twice. So obviously I will advise all my dear colleagues, get into the digital. This is the moment.
See, that's amazing, because right now that we are having this conversation, you are putting that entire thing on how going digital and putting patient experience and patient comfort above all else has helped you build this whole thing. So would you say that scanners had, if not an entire 100% role, but a huge amount of role?
Absolutely. But I am envisioning that it would be a day where every dental chair there would be a scanner.
Wow.
It's not like where a scanner is required, every dental chair there would be a scanner. I mean, today in my practice I cannot think a day without a scanner.
Yeah, I think that should be the goal for every dentist.
Absolutely, it has to be there. And world is experiencing it. Since last couple of years, if we check the data all worldwide, scanners have got a boom.
Mm-hmm.
That's a boom which has happened, and this is the way to go.
That's amazing. I think then all the dentists who are considering about even getting one scanner should really go ahead with a scanner.
It's no brainer. You close your eyes and you have to have it. Absolutely.
So why did you choose ChairSide to get your scanner?
Whether it's ChairSide or Illusion, but the backbone, the whole entire Illusion team with Rajesh Bhai leading from the front, with again Mr. Samir Merchant, Amrish Bhai, we have known them since so long, and what we have known about them is that they will always stand behind us at any given time, 24/7. So when it comes to equipments, technology, the most important is this post-sale service, and if we don't get service, it's gone. But here I was damn sure if Illusion is in, ChairSide is there, Rajesh Bhai is behind this, we don't have to worry. I just close my eyes, I got the first scanner, got ahead with the second scanner. No business. That is the trust and confidence we have with them.
That's amazing. Thank you so much, sir, for having that faith in us. We
Most
really appreciate your
pleasure.
support.
Yes.
Thank you.